This video presents examination of the motor system, which includes assessment of body position, involuntary movements, muscle bulk, muscle tone, strength, and coordination, and testing of the reflexes, which assesses both motor and sensory functions. In this video, you'll see the examiner assess a healthy patient. In clinical practice, you may detect the same normal findings in patients, or you may discover normal variations or abnormal findings. Assess muscle strength in the legs.
Relax.
Test hip flexion by placing your hand on the patient's anterior thigh and providing resistance.
Relax.
Then test hip extension by placing your hand on the patient's posterior thigh and providing resistance.
Push your thigh down against my hand.
To test hip abduction, place your hands firmly on the table outside the patient's knees. Ask him to spread both legs against your hands. To test hip adduction, place your hands between the patient's knees and ask him to bring his legs together. Note the strength.
Try to lift your foot off the table.
Continue by testing muscle strength at the knee. To assess extension, support the patient's knee in flexion and ask him to straighten his leg against your hand.
Try to lift this foot off the table.
Note the strength and compare it with the other side.
Relax. Don't let me lift this foot off the table.
To assess knee flexion, shift your hands, but leave the patient's leg flexed at the knee. Then ask the patient to keep his heel on the table as you try to straighten the leg by pulling it upward. Again, note the strength and compare it with the other knee. Finally, test dorsiflexion and plantar flexion at the ankle by asking the patient to pull up and push down against your hand. All of these tests can also be performed with the patient seated and holding on to the table for support.
Your knee up towards the ceiling.
Hip flexion,
Your knees apart.
hip
Hard
abduction,
as you can. Relax. Your knees
hip
together.
adduction,
Hard as you can. Relax.
knee extension, knee flexion,
Relax. Down against my
ankle
hand.
plantar flexion,
Relax.
and ankle dorsiflexion.
Relax.
Begin the examination of the motor system by observing the patient's body position at rest and during movement.
I'm going to move these up for a minute.
Also, watch for involuntary movements.
Can I see your hands?
Next, assess muscle characteristics, beginning with muscle bulk. To do this, carefully inspect the muscles of the shoulders, arms, hands, thighs, and legs, noting any atrophy.
Let me do all the work here.
Then, evaluate the patient's muscle tone or resistance to passive stretch. Encourage the patient to relax. Then take one hand in yours and, while supporting the elbow, flex and extend the patient's fingers, wrist, elbow, and shoulder in one coordinated movement. The patient's arm should move easily and smoothly with little resistance. Repeat on the other side.
Once again, let me do all the work.
To assess muscle tone in the legs, extend the patient's leg at the knee and move the foot up and down at the ankle. Note the patient's resistance to your movements. Assess muscle strength using force compatible with the patient's strength. Usually, the patient's dominant side is stronger than the non-dominant side. Begin by testing flexion and extension at the elbow by having the patient pull and push against your hand.
Straighten it out. Push away. Bend your fist back.
Next, test extension of the wrist.
Make a fist. Bend your fist back. Around my fingers.
Now test the
Squeeze as
patient's
hard as you
grip.
can.
Cross
Don't
your
let
middle
go
and
now.
index fingers to protect them.
Good.
Then ask the patient to squeeze as hard as possible while you try to remove your fingers. Normally, you should have trouble removing them. Continue testing muscle strength by asking the patient to turn his palm down and spread his fingers. Check abduction by trying to force them together.
Relax for a second.
Then, test opposition of the thumb. To do this, ask the patient to try to touch the tip of his little finger with the thumb while you resist the movement. Begin assessing deep tendon reflexes by testing the biceps reflex. To do this, the patient's arm must be relaxed, partially flexed at the elbow, and positioned with the palm down. To stretch the muscle, depress the biceps tendon with your thumb or index finger. Strike your thumb or finger briskly with the reflex hammer. You should feel the biceps muscle contract and see flexion of the forearm. Here you see a 2+ response.
Just keep your arm as relaxed as you can.
To assess the triceps reflex, flex the patient's arm at the elbow with the palm toward the body and pull the arm slightly across the chest. Strike the triceps tendon above the elbow. Watch for contraction of the triceps muscle and extension at the elbow. Here you see 2+ responses. To elicit the brachioradialis reflex, the patient's forearms should rest on the lap with the palms down. When the patient is ready, strike the radius 1 to 2 inches above the wrist. Observe for flexion and supination of the forearm. Again, you see 2+ responses. To test the knee reflex, locate the patellar tendon in the patient's flexed knee. Briskly tap the tendon just below the patella. Feel for contraction of the quadriceps and look for extension of the knee. These are 2+ responses. To test the ankle reflex, extend the patient's leg somewhat at the knee, dorsiflex the ankle firmly, and strike the Achilles tendon. Feel and watch for plantar flexion. These are 2+ responses.
Support your foot.
To elicit the plantar response, stimulate the lateral aspect of the sole of the foot from the heel to the ball, curving medially across the ball. Use the lightest stimulus that will provoke a response. Note movement of the toes, normally flexion. Dorsiflexion of the big toe with fanning of the other toes is a pathological response known as the Babinski response. For a patient who cannot sit up, all of these tests can be performed with the patient lying down. Biceps reflex, triceps reflex, brachioradialis reflex, knee reflex, ankle reflex, plantar response, and ankle clonus. Dorsiflexion of the big toe with fanning of the other toes is a pathological response known as the Babinski response.
Relax your ankle.
If leg reflexes seem hyperactive, test for ankle clonus. To do this, move the foot up and down a few times and then sharply dorsiflex the foot. While holding the foot in dorsiflexion, look and feel for sustained rhythmic oscillations. A few beats may be normally present.
Now.
If leg reflexes are symmetrically diminished or absent, use reinforcement. Have the patient lock his hands and pull just as you test the reflex. To reinforce arm reflexes, ask the patient to clench his teeth. If you suspect meningeal inflammation, test for meningeal signs. With the patient lying down, place your hands behind the patient's head and flex the neck forward until the chin touches the chest if possible. There should be no resistance or pain. As you flex the patient's neck, watch his hips and knees. Normally, they should remain relaxed and motionless. Hip and knee flexion with this maneuver is a positive Brudzinski's sign. Finally, flex one of the patient's legs at the hip and knee, and then straighten the knee. This action normally produces discomfort behind the knee during extension, but should not cause pain. Pain and resistance to knee extension is a positive Kernick's sign. To assess coordination, you'll evaluate rapid alternating movements and point-to-point movements. Begin by assessing rapid alternating movements. To assess the arms, show the patient how to move his hands. Observe the speed, rhythm, and smoothness of the movements. The patient's dominant hand may be better coordinated.
Using your right hand, I'd like you to
Now
do
ask
this
the
as
patient to
rapidly as
tap
you
the
can.
distal joint of his thumb with the tip of his index finger as rapidly as possible.
And the other hand?
Again, observe the movement's speed, rhythm, and smoothness.
Touch the tip of my
Next,
finger with your
assess
right index
point-to-point movements.
finger. I'll touch
Do
yours.
this several times,
Now go back and
moving
forth.
your finger so that the patient has to change directions. Observe the smoothness and accuracy of pointing. Clumsiness and overshooting with this movement suggest cerebellar disease.
Up, down.
Then, with your finger in one place,
And close
ask the
your eyes
patient to
good.
point to it, raise his arm, and lower it to touch your finger. After several times, have the patient do this with his eyes closed. Inaccurate pointing with the eyes closed suggests a loss of position sense. Repeat on the other side.
I want you to tap my hand
To
with
assess
your
leg
foot as
coordination,
rapidly as you can.
ask the patient to tap your hand as quickly as possible with the ball of each foot. Note any slowness or awkwardness. Compare sides. The feet normally perform less well than the hands. To test point-to-point movements of the legs, ask the patient to place one heel on the opposite knee and then run it down his shin to the big toe. The patient should be able to do this smoothly and accurately. Note any tremor or awkwardness. Assess both legs. Continue the examination by observing the patient's gait,
Over here.
which provides information about coordination, position sense, and muscle strength.
Relax. Walk slowly across the room.
As the
turn,
patient
back
walks,
again.
observe his posture, balance, arm swing, and leg movements. The gait should be relaxed and balanced with easy alternating arm swings. The face and head should lead the rest of the body on turns. Next, ask the patient to walk heel to toe in a straight line. This kind of gait, also called tandem walking, assesses cerebellar function and position sense. Then have the patient walk on his toes to test the strength of plantar flexion, and on his heels to test dorsiflexion at the ankles. These actions also test balance. Next, ask the patient to hop in
I want you to
place,
hop up and
first
down
on one leg
foot
and then the
and
other.
Can you hop
This
up and down
ability
just on your
indicates
right
an
foot?
intact motor system in the legs, normal cerebellar function,
left foot?
and good position sense.
Good. Now I want you to stand just on your
Finally,
right foot.
ask the patient to do a shallow knee bend, first on one leg and then on the other.
Down.
Perform the
stand with your
Romberg
feet
test, which primarily
together
tests
with your
position
ankle bones
sense.
touching.
To do this, ask the patient to stand with his feet together.
Look straight ahead.
Normally, he should be able to maintain this posture with his eyes open, indicating intact
Close your
cerebellar
eyes.
function. Now have the patient do the same thing for 20 to 30 seconds with his eyes closed. His posture should remain steady with only minimal swaying, indicating intact position sense.
Open
If
your
the
eyes.
patient maintains this posture with his eyes open, but not with his eyes closed, he has a positive Romberg test.
I want you
Now
to
check
bring
for
your
pronator
arms up,
drift.
Straight
To
out.
do this, ask
your
the patient
palms
to hold
pointing
his arms
straight up to the
forward
ceiling.
and parallel with the palms up, and to close
Now
his
close your
eyes for
eyes.
20 to 30 seconds. Normally, the patient can maintain this position,
Straight out.
but watch for downward drifting of one arm and pronation of the forearm, which suggest mild hemiparesis.
Stay just as you are. Don't
Finally,
open your eyes.
ask the patient to keep his arms up and eyes closed while you tap the arms briskly downward. Normally, the patient's arms return smoothly to the horizontal position. To summarize, the neurologic examination of the motor system and reflexes includes observation of body position and involuntary movements, assessment of muscle bulk, muscle tone and strength, evaluation of coordination, and testing of deep tendon and other reflexes.